Dr. Shikha Sharma. Usually, people think, especially who are diabetics, that we are already following all the rules, we are already having a low calorie diet, we are already avoiding potato, sweet, sugar, rice, and yet our diabetes is not getting controlled. So you'll be surprised to know diabetes is not just a disorder of high blood sugar. Diabetes is a disorder of the entire body which has very high internal inflammation. Now you might ask that what is internal inflammation? Internal inflammation means, in a very layman language, internal wounds spread across the body, in your blood vessels, in your organs, in all your cells. And how does it impact diabetes? The way it impacts diabetes is that the food which you are eating, the job of insulin is to give a signal to the cell to open its door and let the food go inside the cell. In a very layman terms, when there is inflammation, this communication is completely disturbed. So there is a lot of food going in your blood vessels, but the cells are not opening their gates to allow that food to come in. That is fundamentally the problem in diabetes. It is not that you have less insulin, at least in type 2 diabetes, that's not the problem. So why have the gates not open of the cells to allow that nutrition to come in? The reason is communication breakdown. So insulin is unable to communicate that please open the gates and let the nourishment come in. So that means to treat diabetes, it is not just enough to stop potato, rice or sugar. That is okay, that's good, but that's not enough. That will not treat your diabetes. For actually reversing your diabetes, for actually stopping the diabetes from becoming worse, as you know that diabetes is a chronic disorder which becomes worse with time. It damages your kidney, damages your eyes, it damages your nervous system, and the end results are pretty morbid. So to control and stop that diabetes from going any further and to marginally reverse it, the treatment is very different. It is not just medication, it is not just stopping sugar, it goes beyond that. It is resetting your body and controlling your inflammation and bringing your inflammation inside the body to near zero. And that treatment is the only effective treatment. There are many ways it is done. All the ways, it will be a too long a video if I explain. But some small things which has been talked about in ancient Vedic civilization about the diet, the nutrition, the food you should eat to counterbalance and to reverse diabetes, to reduce and stop it in its track, has been given. One of those foods, of course, is amla. The second, which is connected to amla, and it is a formulation which has 3 fruits, 3 phal, 3 phal meaning fruits, triphala. So all of you know about triphala? It is actually 3 phala. And what are those 3 fruits for amla? One is amla, which is Indian gooseberry. The other is haritaki, and the third is Vedique. When you make a powder of all these fruits and put them in a bottle and have them every day, especially for diabetics, it's also good for other disorders. Any disorder which has inflammation as the root cause. But today we're talking about diabetics, so we know that it is good for diabetes. It's important for diabetics. A lot of people do not know. They think triphala is only for if you have constipation. They only know a very limited benefit of triphala. They do not understand that triphala is actually an alkalizing agent. It makes your system, reduces the inflammation. When we talk about acid alkali, it's not about acid and alkali. It's basically about inflammation and lack of inflammation. And that is what is required. One of the things, a very small thing in diabetes. It is also important in diabetes to identify foods which are causing inflammation in the body. and to immediately put a stop to that. In different bodies, it could be different. In some people, it could be wheat. In others, it could be milk. In third, it could be something else. Which means that depending on the body type, the food which is inflaming your body also could be different. And that is the most important thing in diabetes management, which will actually make an impact and control your diabetes.